Can tirzepatide cause blood in stool as a side effect? Blood in stool is not a recognized side effect of tirzepatide, but the medication's gastrointestinal effects may indirectly contribute to conditions causing rectal bleeding that require medical evaluation. If you're taking tirzepatide and notice blood in your stool, it's completely understandable to wonder if the medication is the cause. This is an important topic because while blood in stool isn't a recognized side effect of tirzepatide, it always requires medical attention to figure out what's going on. Let's start with what tirzepatide is. It's a dual GIP and GLP-1 receptor agonist that's FDA approved for type 2 diabetes under the brand name Mounjaro and for chronic weight management as Zepbound. The medication works on your body's hormone receptors to help regulate blood sugar and appetite. Now here's what we know about blood in stool and tirzepatide. According to FDA prescribing information, blood in stool is not listed as a typical side effect of this medication. That said, tirzepatide does commonly cause gastrointestinal effects like nausea, diarrhea, vomiting, and constipation, and these are well-documented effects that happen because the medication affects how your digestive system works. So where does blood in stool come into the picture? While tirzepatide doesn't directly cause gastrointestinal bleeding, its effects on your bowel function may indirectly contribute to conditions that do cause bleeding. For example, if you're experiencing severe diarrhea, that can lead to anal fissures, which are small tears in the tissue, or if you're dealing with constipation and straining, that might cause hemorrhoids to bleed. The medication affects gastric emptying and bowel motility, which can create an environment where existing gastrointestinal issues become more noticeable. It's also worth knowing that some things can make your stool look darker without actual bleeding. Iron supplements and medications like Pepto-Bismol can do this, but if you're seeing bright red streaks, dark tarry stools, or blood mixed with diarrhea, that needs to be checked out. If you notice any rectal bleeding while taking tirzepatide, here's what you should discuss with your healthcare provider. They'll want to know about the characteristics of the bleeding. Is it bright red or dark? How much are you seeing? They'll also ask about your other symptoms like abdominal pain or changes in bowel habits. Your doctor might recommend some practical strategies to help manage the gastrointestinal effects of tirzepatide. This could include your clinician adjusting your treatment plan, making dietary modifications, or ensuring you're staying well hydrated. And here's something really important. Do not start, stop, or change your tirzepatide dose without your prescriber's instructions. Your healthcare provider will determine the best approach for your situation. Now let's talk about when you need immediate medical attention. Seek emergency care if you're experiencing large volume bleeding, severe abdominal pain, or signs that you're losing too much blood, like feeling dizzy or faint. If you're taking blood thinners and notice any bleeding, that's also a situation that needs urgent evaluation. Dark, tarry stools can indicate bleeding higher up in the digestive tract and should be assessed promptly. There's another important consideration here. If you're 45 or older and experiencing new rectal bleeding, the U.S. Preventive Services Task Force guidelines recommend investigation to rule out colorectal malignancy. This isn't meant to alarm you, but it's an important screening consideration for adults in this age group. Your healthcare provider has several tools to figure out what's causing the bleeding. They'll start with your clinical history and a physical examination. They may order laboratory tests to check for anemia or other issues. Depending on what they find, they might recommend endoscopy procedures like a colonoscopy or upper endoscopy to look directly at your gastrointestinal tract and identify the source of bleeding. So let's recap the key points. Blood in stool is not a recognized direct side effect of tirzepatide, but the medication's gastrointestinal effects may indirectly contribute to conditions like hemorrhoids or anal fissures that can cause bleeding. Any blood in your stool requires medical evaluation to determine the underlying cause. And remember, your healthcare provider can work with you on strategies to manage GI side effects and reduce your risk of complications. This video is for educational purposes only and is not medical advice. Always consult with your healthcare professional for personalized medical advice about your specific situation. They know your complete medical history and can guide you on the best approach for your individual needs. Have you experienced gastrointestinal side effects while taking GLP-1 medications? Share your experience in the comments below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.